Hey everybody, I'm at SkinSpirit with Lindsay today. She's hiding, yeah. She's going to do Sculptra and Dysport, right? Yep. And the Sculptra will help me look not so hollowed out here, right?
Yep.
Yeah. I mean, usually people like to look really hollowed out there, but I feel like I look a little bit too much.
Well, she's thin, and she's tricking you for her birthdays too. So the older we get, we'll lose bone and we lose fat and we lose a little bit of muscle. So this is just going to stimulate collagen to lift away from this midline so that that the volume doesn't come midline and feel as heavy. And you'll see it immediate, which is pretty cool. So I'm going to start with her Dysport, and she's been like a while. She's more in a maintenance time, so we think it's been like 6 months-ish since her last Dysport. And it does take a couple days to work. So first thing you're gonna do, Judy's just gonna squeeze your eyes in tight and now relax that. So what I'm doing here is just opening up her brow a little bit. This is the orbicularis oculi muscle and it pulls down. And I'm just releasing it to open up. Pull the eye in tight like you're just squeezing your eyes in tight. And look at me again. And then relax. So I'm just watching where she's activating that muscle and releasing it. Okay, scowl like sun is in your eyes and then relax. So Dysport takes 1 to 3 days to work. Full effect is 14 days. Longevity is 2 to 4 months. Scowl and then relax. So we put this medicine anywhere there's wrinkles caused from the muscle moving. So we call those dynamic wrinkles. So typically that's the scowl, the forehead around the eye, and then sometimes pursing of the lips and even the chin. Okay, scowl again, and then relax. And Judy takes really good care of her skin, so her skin looks really nice and refreshed, but this will just add to that. Okay, scowl again, relax. One little baby poke.
Now, Lindsay, you said that if I refer anybody in, they will get $50 off.
Absolutely.
So, if you want to get $50 off on your treatment, come into SkinSpirit and see Lindsay. Tell her that I sent you.
Yes. Scowl again and then relax. Yep, so the cool thing is our referral program's awesome because you get a great service at a discount. And those are my favorite clients too. We end up becoming very good friends. Okay, so that is it for Dysport. Minimal swelling and bruising. You're gonna see a couple little almost mosquito bites, I guess I would say, like a little lump and bump for maybe 5 minutes. It's not long. Pain-wise, what would you say?
It didn't hurt.
Okay, I mean 1 if we had to give it a number. Between 1 and 10. A 0.5.
Yeah, because I don't even remember it.
Okay, perfect. So obviously, minimal, no downtime, minimal pain, very straightforward.
But did we numb that area?
No, I didn't.
Oh, okay. No.
I could pretend. No, it's the smallest needle. It's a 31 gauge needle. So again, that pain's just so little, it's just not worth numbing. Now, what I'm wiping off is numbing cream though. I'm gonna use a little bit bigger needle for her Sculptra. And honestly, the thing about this needle is it's longer. So it allows me to get to more places at once. And then
turn on the distractor.
Yes, this is her distractor. So this is just, it's called a vibrata, little Goldie, and it just distracts the nerve. So the nerve can only feel one sensation at a time. So we're kind of tricking the nerve to just feel this vibration instead of feeling the poke. This also is minimal in regard to pain, but it's more than Botox, if we're being honest. Okay, so I'm gonna have her turn to me. Yep, and then I actually am gonna have you come around this corner. And for her, I want to lift the back part of the jaw and what's called preauricular in front of the ear area. Okay, so deep breath in. I'm distracting her with my tap. Sometimes these needles get clogged, so I have to do little tricks. Doing okay?
Mm-hmm.
Okay, so I just put a little bit of pressure in the area where I just treated her. Sculptra actually comes in a powder, and I mix it with a little bit of saline or sterile water and lidocaine. So you do see the volume right when we do it, but I do like to massage it to help it dissipate and to be even.
This helps my body build the collagen.
Exactly. So this is 100% collagen stimulating. So if people are familiar with filler, what we refer to as filler is typically made up of hyaluronic acid, which is a normal substance in the dermis. And you see that volume immediately. It's typically a gel form. This is a little different. It is instead of working on the hyaluronic acid, which is a normally in the dermis, you have elastin, collagen, and hyaluronic acid. So this is just a different way of lifting in the dermis. So you do see skin improvements with this, and then you'll see lifting and appropriate volume. So there are certain areas I don't do filler, and most of these are the areas that I'm treating with Sculptra. So I like to do filler around the mouth, where it's a little more mobile because filler has flexibility. I want you to think of this as more scaffolding. I call it the stage crew. It's lifting. Every good stage, every good show has people in the background doing something. That's my thing. That's Sculptra. Okay, for her, Judy's cheeks look perfect. They have the perfect symmetry. She's got what we call a G curve. What I'm gonna do is go in her stage crew, and I'm gonna lift her in the back part of the face. Yeah, perfect. Okay, breathe in. So this is hairline area. It's an area we don't really see on ourselves that we're losing volume, but trust me, you are if you're 40 and above. So again, I'm just gonna put slight pressure, gentle massage. I say the word gentle, she may not. It's okay. So what tomorrow she'll be sore. Yeah. So tomorrow, this is a product that is your tender after. The needles themselves aren't horrible, but she'll do some massaging. We call it post-care. So she's gonna massage all the areas that I injected today, and she'll massage for 5 minutes, 5 times a day for 5 days. So it is a little bit of homework. That being said, it's pretty easy. And again, I just like to hold pressure. If I can minimize any bleeding, she can minimize bruising. To me, minimizing bruising minimizes her pain and her downtime, her aftercare. Okay, so that's back there. How are we doing?
Good.
Perfect. Okay, so second place, we're gonna do a little bit in the mid face and a little bit in this pre-gel in this little piriform area kind of by the nose.
I'm getting this ready now.
You should. I know, I don't do squeezy balls. That one seems to be a little bit more effective than just squeezing away. And, okay, so I'm going to turn to me just a little bit. Okay, you can close. Deep breath in. So I'm actually one of the trainers for this product. I train local injectors, skills to inject this, and it's one of those things that is a no-brainer to switch to around 40. So filler's great. It serves its place for lips, around the mouth, places like that, but I feel like Sculptra gives you the most bang for your buck and gives you the most natural look. Okay, we're on jawline.
Do you want this on here?
On the left side's great. Okay, breathe in, breathe out. That one can be stinging. Doing okay?
Mm-hmm.
And again, you can just see me just Because this is a fluid, it's water, I like to spread it out where we've injected it. And I'm pushing kind of hard. It's not a nice, relaxing massage. Okay, turn to me. Okay, this one you're not gonna move. Actually, a little more straight. Okay, so I'm gonna help. This is where our bone collapses. So as we age, the bone actually folds in, the skull goes in, and then the jawline shortens. So if you look at the jawline, and then she's less, it's a little harder to see on her, but the jawline comes in and we lose bone here, and it creates this little extra skin. So I'm gonna actually give her some bone support by putting a little bit of Sculptra through here. This is definitely an advanced technique, so you may not see a lot of people do this, but I've been doing this for 10 years. Okay, so deep breath in, deep breath out, stay there. Slow deep breath in. Okay, sometimes my needles clog, and of course it did, sorry. That's a rude spot to poke you twice. We talked about me not being perfect. But once I get this side done, we'll have her look at the camera and kind of show you the gentle improvements. Okay, sorry, one more time here. Breathe in, breathe out, stay there. So this is a more natural way of improving these smile lines. Sometimes people's smile lines can get a little over injected, and I think look less natural. This should be a very natural improvement that will help this junction right here. It can also lift the lip a little bit. Okay, so I'll have you like look in the, it might be a little hard to tell on the camera, but some lifting through here. She's got a little bit of swelling right there in the hairline, which is fine. Lifting through here, 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 and here, and then turn. So if you look, she still has some hollowing right here in front of the ear. It's gonna be hard to see in her hairline, but here, and then moving forward a little bit here, here, and here. So she should look refreshed. She actually shouldn't look injected. She should just look like Judy on her best day.
My best day that lasts forever.
Yes.
Just kidding.
It does last a long time. So Sculptra is a 2-year product. So they stopped the study at 25 months. And when they initially did the study, it was actually really cool. They studied HIV positive patients. So as you can assume, these patients were immunocompromised. They had extreme bone loss, fat loss, and muscle loss. So they showed that you could get collagen stimulating in that population, which really means this product could work on anyone. So that's what's nice is there's very few people that are candidates, that are not candidates for Sculptra. So almost anyone is, yeah. And then results are slow. So usually we'll do a couple of treatments. That second treatment's normally around 8 weeks. And depending how much volume and lifting we want, we'll usually do a couple vials. So 3 is common, but I typically separate them every 2 months. So each person, I kind of give their own recipe, and then we look and see how you're responding to Sculptra, and then we kind of come up with a plan together. Okay, deep breath in. Breathe in. So again, you can see how beautiful her cheekbone is. She has really nice projection and volume there. But she lost some fat here in front of the ear. And when you lose fat here, the gravity has nowhere to go but forward. So we're truly lifting this area back. Next time I treat her, I may go a little more toward her jawline, but I'm hitting this place first to start lifting there, and then we can contour later. So I'll typically change what I do each treatment depending on how she looks. And then the treatments, the injections around her mouth, I only do once a year for just bone loss prevention. Okay, hairline, breathe in. But like today, I think I'm doing 4 Sculptra. It's my jam. Yeah. And it's really, they used to call it the Hollywood secret because it was slow, it's lifting. They used to call it the liquid facelift. There's been a couple of different names, but It really is something that you can keep private if you like. You can obviously brag to your girlfriends or boyfriends about it, but it is really, really natural. The product itself is out of your system in like 6 months. And so it really is just stimulating your collagen and waking up your collagen. So it's unique. Okay, we're almost done. How are we?
Good.
Good. And Judy's like a pioneer. We've done this before on her. So she's tough, but even on my clients, it's their first time. We try to do as many measures as possible to keep you comfortable. I always tease I wouldn't have a job if I caused people that much pain. Right? Yeah. We have a pretty window. You can look out that. So I'm gonna do around her mouth and her cheek, and then I have one more syringe. I'm gonna decide. I'm gonna have her look with me, but I may do a little bit more jawline, or we could talk about temples. When we talked before, we felt like her temples looked okay, so we may leave those and just do jawline.
This is what's
bugs
bugging
her
me the most.
Yeah, so I probably will. See, there we go. We already know.
We already know.
Yeah, and it doesn't mean we can't do a little temple next time, but I feel like let's kind of hit that area that's bugging her, and then we'll go from there. Okay, sorry, I have to turn a little more. Perfect. Deep breath in. So this is that apple, I call it the apple, that blush spot that a lot of people use makeup to contour. Sculptra will give you that contour with no makeup. It's a very anti-aging area. You just don't want to hyper inject it or else it will look really unnatural. Okay, breathe in. And just be careful right here. You have a tiny little blemish, so just stay away from it. So just when you're massaging, you just stay under that little blemish.
It's not tiny.
Well, welcome to maskne.
Yeah.
I have another way we can fix that. We can put a little acid on it.
Actually, I spilled
Salicylic.
coffee
Did it
in
hurt?
my mask because I put my mask down to drink coffee and the coffee spilled in my mask.
Oh.
Yeah, it was
That
lovely.
felt really good.
Mm-hmm.
Okay, so one more around this nose area.
I like coffee. It's kind of my...
Who doesn't? The scent is very nostalgic. It's very calming. I feel like. Okay, around the nose. Stay there. I know this one's a little bit. I don't know why I keep getting these naughty needles in that spot. I'm so sorry.
That's okay.
2 for 2. She has to say that's okay. Just kidding. We really are almost done now. And the other spots will be a little more numb. So I did put a little bit of numbing in this. And so hopefully your other spots will be a little less ouchy. Okay, I'm gonna kind of go faster. Breathe in. She is champing on. Okay, 2 more pokes and she's done. So it's gonna look like a lot. If you've never had injections before, you're gonna be like, ow, that looks like a lot. But honestly, if you're doing a full correction on someone or looking to do that, we lose, first of all, our collagen stops producing by about 50% by the time we're 50. And then the amount of what we call mLs on the face that you lose is anywhere from 10 to 15 mLs by 50. So 1 syringe of filler is 1 ml.
Mm-hmm. Oh, wow.
So just envision like, we're not doing 15 mLs today, so this will be 7, but you can't really think of it in that way because it's just it's more stimulating collagen. But so when people say, yeah, you need a couple syringes, now you can put it in perspective of like, oh, I've lost 15 syringes, I'm gonna only do a couple.
Mm-hmm.
Yeah. Okay, again, I'm gonna lift up her jawline. Breathe in. So I'm not trying to masculinize, I can't say that word, make her look masculine, but she's lost volume there, and so we're just gonna give her a sharper jawline. She's still gonna have that feminine heart-shaped face. Okay, turn this in all the way. But when she looks in the mirror, she's gonna be like, thank you. Okay, last injection. Again. Okay, and you can really see that I went right back for that jawline on this guy. Okay, so I'm gonna let her look, and then I'm gonna show you what the massage looks like. And then we really are done.
Oh wow.
Are you feeling refreshed?
Yeah.
So you like to swell up here, which is fine, but you are gonna massage back here in that hairline, and I'll show you how to do it. I honestly left your cheek mostly alone. I just used that hairline on both sides and just kind of worked it this way. And then do you see that last injection, how that helped that jawline a little bit? So you should feel relieved in this lower face.
Yeah. So I felt like, you know, I get that people use that contour.
Yes.
But
Yes.
why would they do that?
Yes. Well, but then it's shadowing. So then what happens as we age, that shadow changes. And so instead of having kind of this round, if you get too hollow, it looks skeletal, to be honest. So it becomes less human-like and more, people look sick, for lack of a better word, right? Like if you think of someone who is ill, they've lost a lot of fat in their face. So I really feel like this restores that health. And my thing about injections, Judy knows this, is, you know, if you're eating as best you can, you're exercising. For me, that's where I put injections into my life, is just taking care of your skin, taking care of your face. And if you're already doing it for your body, it's pretty seamless to improve the health of your skin. And what's unique about this one, like I was saying, is it does help your skin. So there's a lot of, you know, products that we talk about loss of collagen, but there's not a lot of ways to improve it. Yes, there's some supplements and drinks and things. Topically, it's pretty difficult. So where we're getting right into the dermis and stimulating it on site, you just get these great, we call it the Sculptra Glow skin improvements. Okay, so you cannot massage wrong, so yay for that. But you're gonna massage 5 minutes, 5 times a day, 5 days. She's basically gonna go over those areas I treated. So I like to describe it as fertilizer. If you were to put fertilizer on your grass, you'd put it everywhere. You wouldn't just put fertilizer in one little baby spot in your lawn. It would burn it. So think about stimulating as much as your own collagen, hence the post-care. And then the second reason is it does help. Historically, Sculptra could cause a nodule. I don't see it anymore. We do quite a few things different than we did with the studies, but that's the other reason, is it can help prevent any side effects. Bruising, I don't see any. Sometimes late bruising can happen and I don't see it. She had a tiny bit of bleeding, nothing crazy. So the biggest thing for her is she's gonna be sore. And then I just say, don't exercise right after, let everything kind of chill. And then she'll wash her face normal tonight. And then she can do, if you're gonna do makeup, I typically do like you to not use your brushes that you've been using, or at least clean them. And then you can do makeup tomorrow, or you can just do sunscreen with our lovely masks. Okay, do you want me to put a little sunscreen on top too?
Oh yeah. Okay, we'll do sunscreen.
We're gonna bust.
That's all I've been doing lately. Because
Me too.
Why wear makeup with my
Yeah.
mask?
No, me too.
Like,
And
just ends up in the mask.
yeah, I've been using like it's almost like a makeup sunscreen, but it's like in a palette, and it has a little bit thicker coverage. So I've been doing that during these masked times. And befores and afters on her, it's gonna be a minute. You know, this is a patient injection. This is one you have to just kind of trust the process. And my favorite is just that people make up their own story about you. They'll say, you are handling COVID so well. You look so rested, or whatever the story is. People can't put their finger on why you look good. You just look better, more refreshed. And so that's why I probably do this treatment the most, is because it's very lifting, it's very anti-aging, and it's globally improving versus just treating one area of the face. Okay, we'll let you sit up one more time. I'll sit this up and we'll give one last look, and then Judy can always shoot me questions if you guys have any questions. I think she can tag me. Isn't it beautiful?
Yeah.
Yeah, I hit that jawline one more time, and I think that made a difference. If you look in the, just massage this one spot. But that back corner, I got that front, this I got, but that second one, I really came back here. I just want this to come a little more forward, sorry. I'm pushing on her hard. Okay, there we go. Okay. Yeah, and then see this little corner? Yeah, doesn't that look better? But look how pretty your cheeks are. I mean, I did nothing to them. I mean, I helped this spot, but then just like if you lift it and then don't hyperfill it, and then you have a tiny bit of swelling right there. Can you see that? That will go down. That's where my needle was. She's glowy. She's got the, you have the glow of my moisturizer in that. Anything else, Judy?
I think it's good.
Okay.
Perfect.
And then her eyes will lift a little bit. This will smooth out through the scowl a little bit, and results will just get better and better. She'll look kind of the same for a couple weeks, and then she'll slowly start to, you'll feel improvements.
Yep.
Okay. Thanks for joining.
Say bye.
Bye, sorry.